Stand by. This is your 1-minute warning. Stand by.
Okay. Good afternoon. I will welcome Dr. Shah in a moment to deliver his daily update. First, I want to share some news. I remember almost 5 months ago now, it seems like a year or years ago, but I was at a lumber mill in Searsmont. I spoke about the serious challenges facing the Maine state economy. For the last decade, our economy has been growing slowly. Our aging population has left employers seeking a qualified, ready, and able workforce, while at the same time our children and young people were leaving to find jobs elsewhere. I spoke then at that lumber yard about our assets, from our vast natural resources to the steadfast character and resolve of Maine people, that to an unmatched quality of life. Those things that would drive us to meet our challenges head on and seize our opportunities. After listening to more than 1,300 Maine people, we then outlined the state's 10-year economic plan, first of its kind in decades, a plan to drive collaboration and jumpstart the economy and achieve a diverse, forward-looking economy that would offer everyone the chance to succeed. We knew that the plan would be the foundation of our future, but we sure didn't know at that time how critical it might be. Since that December day in Searsmont, Maine, a pandemic has wreaked havoc on our national economy and dealt heavy losses to businesses of all sizes, and millions of people now find themselves unemployed across the country. And like all other states, Maine will be impacted over the long term as well as the short term by changing consumer confidence and buying trends, evolving technology needs, decreased interstate and international travel, stock market volatility, supply chain challenges, and a decrease in the national GDP and the state GDP, along with the upside of low interest rates and lower gas and oil prices currently. The state of Maine's economy is also affected by this pandemic, but in different ways than other states, ways that are attributable to our demographics, some of which I've mentioned: our large service sector, our high percentage of older individuals, our proximity to New Hampshire, New Brunswick, and Quebec, the large number of nonprofits we have, and small businesses and seasonal enterprises. Maine's agricultural sector and our commercial fisheries, for instance, depend on the restaurants and banquets and university cafeterias and school lunch programs, and those are now closed or reduced in capacity in order to minimize the spread of this deadly virus. So there's a chain reaction here. Tourism will continue to be impacted by travel patterns and desires, and we are evaluating our travel restrictions day to day, but they're also affected by changing modes of recreation and lower consumer spending nationally. Healthcare, manufacturing, childcare, the arts, and higher education are all facing new pressures and challenges due to this pandemic. At the same time, the pandemic forces us to reimagine how we do everything, from business to healthcare to recreation and education, how we elevate the lives of lower and middle income families to ensure that they can withstand an economic downturn, how we eliminate disparities in rural versus urban populations, especially when it comes to affordable health care, how we invite new investments and innovations in models of business and communication. To address the challenges that have hindered our economy as a result of this pandemic, we need short-term and long-term policy changes. That is why, while we work to protect the public health and to safely restart Maine's economy now, I am also convening an economic recovery committee comprised of business leaders, economic development experts, economists, municipal officials, lawmakers from both sides of the aisle, representatives from unions and nonprofits, tribal and immigrant communities, and the hospital and tourism industries, among many others. People from all over the state, from every sector. This committee, I'm pleased to say, will be chaired by Josh Broder, CEO of Tilson, and Lori LaChance, former Maine State economist and president of Thomas College, both Mainers through and through. I've asked the committee to gather input from experts and industry representatives on the economic impacts of COVID-19 on Maine's economy in particular, and to come back and offer policy recommendations to mitigate those impacts. Those recommendations will address essential issues like strengthening Maine's key industries and small businesses, strengthening workforce development, improving opportunities for lower and middle class families, expanding economic opportunities for rural communities, and attracting new investments and innovations in key sectors such as business, communications, healthcare, recreation, and education, including higher ed. The committee will convene its first meeting as soon as possible and deliver a preliminary report by July 15th and a final report by December 1st. The committee undoubtedly will form subcommittees at the discretion of the co-chairs. All meetings of the committee and any subcommittees will be conducted in a virtual fashion in a manner that is accessible to the public with advance notice online. And to allow for public input and ideas, the committee will create a portal to receive public comments. Members of Maine's congressional delegation are also invited to participate in an ex officio capacity. These recommendations will be the bridge between the current economic emergency caused by the pandemic to the long-term renewal of Maine's economy. This committee will not address the public health matters, including Maine's reopening timeframe. Commissioner Heather Johnson of DECD continues to work very closely with all sectors of the economy and continues to engage with lawmakers and solicit input from the public, something we continue to do throughout this fluid, gradual, measured reopening process. This approach that we engage in now, which draws on the voices of thousands of Maine people and experts from sector to sector, also allows us to act nimbly and to make adjustments and respond to changing circumstances as they arise. This approach allows broad input while allowing us flexibility to adopt changes during this ever-changing and unpredictable public health crisis. To that end, my administration continues to receive feedback on the plan we brought forward last week and take all of that into consideration. I will say that we are looking closely every day at opportunities to pursue regional variations in terms of timing of reopening, particularly for rural counties. My administration will continue to engage with businesses and elected officials on this topic, and we may have changes to announce in the coming days. I'm hopeful. Together, drawing on the many assets of our state, including the hard work and the resilience of Maine people, we will slow down the spread of this virus. We will rebuild and strengthen our economy. And we will rise from this unprecedented challenge as a stronger state where everyone will have an opportunity to succeed and be healthy. Thank you. Now I invite Dr. Shah to give his daily briefing.
Thank you very much, Governor Mills. Good afternoon, everyone. My name is Nirav Shah. I'm the director of the State of Maine Center for Disease Control. Governor Mills and I are joined this afternoon by Commissioner Heather Johnson from the Department of Economic and Community Development as well. I'd like to provide an update on the COVID-19 status across the state. But before I do, I'd like to first recognize an important day today. Today is National Nurses Day in the United States, and as well the start of National Nurses Week all across the country. In light of that, I'd like to take a moment to thank each and every nurse in Maine for the care you provide to our friends, our family members, and our close contacts across the state. We could not be where we are with respect to COVID-19 or any other type of healthcare matter were it not for the men and women of the nursing force across the state of Maine. And on behalf of all of us, we very much thank you. National Nurses Week actually ends next week on May 12th, which happens to be the birthday of Florence Nightingale. Just like the state of Maine, Nurse Nightingale would be celebrating her 200th birthday this year. She was a celebrated social reformer, epidemiologist, and really the founder of modern nursing. And she became well known, as it turns out, for her time taking care of wounded soldiers during the Crimean War. She really pioneered a lot of the concepts that are still in use today. And I'd like to take a moment again to acknowledge our debt to her, as well as our debt to each and every nurse across the state for the care that they provide to all of our friends and family members. Today's briefing overall begins yet again on a somber note. Maine CDC is reporting the death of another individual who has passed away with COVID-19. She was a woman in her 70s from York County, and she marks the 62nd passing of an individual across the state with COVID-19. As always, we offer our deepest condolences to the families of this woman during this time of their grief. Overall, Maine CDC is now reporting 1,254 cases of COVID-19. Of those, 1,174 are confirmed and 80 are considered probable. Overall, 191 individuals across the state have been hospitalized during their bout with COVID-19, and 37 are hospitalized today. Of those 37, 18 are in intensive care units and 12 are on ventilators. Overall, 766 individuals have recovered, and 278 healthcare workers are among those who have been affected. Overall, statewide, there have been now 22,679 total negative tests for COVID-19. Breaking down that number, we've got 22,092 negative PCR tests and 587 negative antibody tests, for again a total of now 22,679. Overall, Maine is now logging approximately 3,300 tests per week, both negatives as well as positives. I'd like to provide an update on one new outbreak as well as one ongoing outbreak. The first on the ongoing front is with respect to the outbreak that's happening at the Tyson poultry processing plant in Portland. Yesterday, I reported that there were overall 37 community cases. Just in the past few hours, we've received all of the test results that we had been awaiting. And overall, we've received results on an additional 14 cases. That brings the total cumulative number of cases affiliated with the Tyson food processing plant now to 51. Now that all of the results are in and the investigation is underway, those numbers will definitely be reported on our tally tomorrow. Thus, the number that I reported today, the 1,254 cases, those do not include the 51 cases at the Tyson plant. They will be included in tomorrow's numbers. And thus, tomorrow's numbers will include those 51 cases as well as other cases that are ongoing in the state, which could result in a large jump tomorrow. But as of right now, the numbers of the total number of Tyson cases are not in our daily tally. We've been waiting, as is our process, for all the results to come in, and now that all of the results are in, they will be officially included in our count. As we discussed yesterday, our epidemiological investigation is underway. We've got a team of epidemiologists who are touching base and making contact with each and every one of the positive cases to undertake that process of contact tracing that we've talked about so many times. But we do so with an eye recognizing the difficult socioeconomic challenges that many of these employees face and the language barriers that we may encounter as we go about that process. In anticipation and in planning for that, we know to make sure that we've got medical translators on hand, as well as individuals who can assist these folks not just with their medical needs, but other needs as they arise. I'd also like to provide a brief report on a new outbreak that Maine CDC has just become aware of. This is an outbreak at the Springbrook Center in Westbrook. Springbrook is a skilled nursing facility, and thus far, Maine CDC is aware, just in the recent few hours, of a total of 4 cases, 3 among residents and 1 case in a staff member. As is our protocol, Maine CDC has recommended universal testing, which is underway, and we understand that nearly 300 samples have been collected and are on their way to our laboratory up here in Augusta for universal testing. As soon as we've got the results from those, even if they haven't been included in our case counts, we will report those out in our continuing efforts to be fast, prompt, and transparent with what we know. Finally, I'd like to provide a quick update on our public health emergency preparedness activities. First, on the numbers. Overall, in Maine, there are 320 intensive care unit beds, 162 of which are available. There are 318 conventional ventilators, 299 of which are available, and there remain available 395 alternative ventilators. And finally, just yesterday alone, Maine CDC, working with our colleagues at the National Guard and the Department of Transportation, shipped out 40 orders of personal protective equipment comprising 30,486 pieces of PPE. Again, that's 40 orders with almost 30,500 pieces of PPE that were delivered to healthcare facilities and first responders across the state just yesterday alone. And finally, before we turn things over to questions, a quick update on the work that our colleagues at the National Guard are doing in order to get more and more healthcare workers fit tested so they can take advantage of N95 masks. Yesterday alone at the Kennebunk Center for Health, there were an additional 29 individuals, healthcare workers, who were fit tested, bringing that total to 70 at that center. And then in today and tomorrow, our colleagues at the Guard are undertaking fit testing at the Port Resources South Portland facility, the Wyndham facility, where they also intend to fit test 70 staff members there, so those staff members too can take advantage of N95 masks. So with that, Governor, I think we'll turn to questions. Sure. And again, we've got Commissioner Johnson here today as well. We've got a full slate from our colleagues in the media. And for today's first question, we will turn to Brad Rogers over at WGME.
All right, thanks very much. This is for the Governor or Commissioner Johnson. Some businesses are permanently closing due to COVID-19. Do you know how many businesses have submitted proposals to open safely now, and have they been approved? Have any of them been approved? And, some businesses say they've submitted plans and not heard back from anyone.
Well,
and I have one other question.
Oh, can we deal with that first? The question from Brad is, how many businesses have submitted a plan, and some of them say they have not heard back from us? Is that correct?
Yeah.
Okay. And essentially, last week alone, Commissioner Johnson was in communication with about 600 different businesses. She's convened work groups of different sectors of the economy, a number of businesses. Yesterday alone, I spoke with the board of the Chamber of Commerce. I spoke with the hospitality industry, the tourism folks. She's been gathering information from all different sectors. It is not purely business by business. It is sector by sector, and dealing with the representatives of those sectors. Some individual businesses have come up with some pretty novel ideas about how they can do business. You know, I've never run a restaurant. I've worked in one, I've waited tables, but I've never run a restaurant, so I can't personally advise a restaurant how to set up so that the salt and pepper shakers are routinely sanitized and all the things that they probably have to go through. What kind of protocol is best for each sector of the economy? Commissioner Johnson, do you have anything to add to that? Or?
No, I think that's perfect, Governor. We have over 3,000 requests in that we're processing through. Most of them fit into some pretty standard sectors. And then I think what you traditionally see are there were still groupings of people that maybe don't fit cleanly and easily into any sector. And those will have kind of more general looks at guidance for best practices across the board to keep people safe.
Brad, what was your second question, Brad?
Yeah, Governor, if hotels are opening for us on July 1st, will you lift the quarantine order then? And is there a plan for law enforcement to start enforcing some of your orders with respect to the quarantine, face coverings, and gatherings of 10 or more people?
Two different questions, Brad. That'll be your second and third, I think. But whether or not hotels are opening on July 1st, what was the gist of the question about that? I'm sorry.
Yeah, well, the question is, I'm sorry, are you going to lift the quarantine order then?
Oh, are we going to lift the quarantine? Look, we're looking at that every day to see if there's some ways around that. Here's the thing. Massachusetts today has about 70,000 cases, positive cases of COVID-19. 10,000 in Boston alone right now. They lost 252 people a week ago today in one day. So we're not simply looking at the state of Maine as some sort of cocoon. We're looking at states around us and other New England states and what the trends are there too. Because interstate travel is something we usually welcome. The tourist industry, all of us love to have people come here and enjoy our beaches and lakes and mountains and spend money here. But this year, right now, they may be coming and bringing the virus. And it might result in the most god-awful consequences, not only for our communities, but for our state economy as well. So we're looking day by day, hour by hour, at how we can better gauge the influx into the state of Maine and how we want to open small businesses. We want to be able to say, come on down, enjoy our state again. We very much want to do that. Right now, the quarantine is the only tool we have at this moment to address the risk of spread of the virus. The second question was about law enforcement. You know,
yeah, I just didn't know if you were planning, if there's a plan for law enforcement to start enforcing some of your orders.
We don't need a plan as such. The orders stand on their own merits. A violation of any of those orders is a misdemeanor crime punishable by up to 6 months and a large fine. It's also subject to potential injunction or licensing actions depending on your type of business. These are responses that are in part local, in part statewide. We also are in touch with the local district attorneys to see if they need any help from time to time in enforcing any particular areas. And the police departments are pretty responsive too. They generally go out in the mindset of community policing and say to somebody, you know, you might be in violation of the order. Maybe you want to do something different. That's our mindset right now.
Thanks, Brad. Next question goes to Steve Missler. Go ahead, Steve.
Hi, I have two questions, one for Governor Mills and one for Dr. Shaw. I'll begin with the governor. I'm wondering if your administration or Commissioner Johnson has have considered any changes to the restaurant reopening timeline, the prospective one that you've given out, especially as it relates to outdoor dining. New Hampshire, as you're probably aware, is allowing some restaurants to open if they have outdoor dining. I think in a week or so. And I'm wondering if that's been something that you guys have considered to do. And I'll ask Dr. Shaw the question after you guys are done.
Okay. I think New Hampshire is looking at doing that as of May 18th, if I'm not mistaken, statewide, but for outdoor dining only. We're in touch with their people and with Vermont and Massachusetts. And we are thinking about making some changes before Memorial Day. I'd like to make some changes before Memorial Day. I think we'll have more to say on that later this week.
That's great. Thank you. And Dr. Shaw, I wondered, what would trigger universal testing in Maine's prisons or jails? Is it just one case in one of those places, or would it have to be an outbreak, which I think you define as 3 or more cases in one facility?
So Steve asks about what would be the threshold for more widespread testing in the correctional system. Steve, one initial note is I just want to underscore again that ever since we started asking other folks to join us at the table way back in January, corrections was one of the first groups that was there. And so they've been with us every step of the way, and we've helped them develop their own protocols for how they evaluate patients and how they assess patients. So, Steve, the question you asked, though, is what would be the threshold for moving toward universal testing? And it really would depend on the conditions at any one facility. So thus far, there have been no confirmed cases, although there have been a number of individuals who have been tested, all of whom have come back negative. So at this time, it seems that correctional facilities are more akin to nursing facilities, which is to say, with quick action, isolation, there doesn't seem to be a threat of large-scale spread, as opposed to, say, homeless shelters, where we have seen one case turn into 20. So it's hard to say at this point, Steve. My inclination is to err on the side of caution. It's such that if we had a single case, probably go in that direction. But it really would depend on the nature of the interaction of that individual and where they were and other folks that they interacted with. But my inclination is to go with the lowest threshold, obviously in the interest of as much safety as possible. What you also, though, find, Steve, to be candid, is that in settings of that nature, where you have a high number of individuals congregating, the time period between the first case and the third case can be a matter of a couple of hours. So usually we're really not in that decision tree. One case can often go to 3 cases before we know it. So it's not often that we really have to face that dilemma for that reason.
Thank you.
You bet. Next question goes to Steve Betts over at the Courier-Gazette.
Yes, thank you, Dr. Shaw. This is for Governor Mills. The city of Rockland is considering closing the downtown section of its Main Street, which is also Route 1, to vehicle traffic during June to allow merchants to sell outside and to have restaurants serve outside. Yeah. Is that something that your administration would support?
I'm not going to comment on the specific city because I'm not on their city council, and I don't take advantage of their traffic patterns as often as I perhaps should. But I've said for weeks, and I think it's a great idea to look at your traffic patterns and see if we can accommodate the downtown businesses, the local businesses, to allow more outside activities, more activities under tents, more promenades. I think about the city of Burlington, Vermont, and what they did with Church Street and how vibrant a place that is on evenings and weekends, you know, near Ben & Jerry's and all the good restaurants there. And maybe we could replicate that in some of our towns and cities. We want to keep downtown businesses alive and well. We want people to come there, but we want them to engage in social distancing, as difficult as that is. Our culture, our habits are changing to become part of the new normal. And that, I think, is a great idea to consider.
Thanks, Steve. We're going to go to Hannah Deneen over at News Center next.
Hi, everyone. So my question first is for Governor Mills, and then I also have a question for Dr. Shaw. Governor Mills, the Republican leaders in the Maine legislature are calling for the removal of your emergency powers over the handling of the coronavirus. I'm wondering if you believe, if you have a response to that, and if you believe that communication has been effective throughout the entire legislature during this time.
Thank you for the question, Hannah. I can't speak for the whole legislature or what's effective to them right now or not effective. I tell you one thing, though. I will not let partisan politics start to draw lines and become involved when we're dealing with the biggest pandemic that this state and this country have ever seen in more than 100 years. I do not wish to engage in partisan politics at this time.
And Hannah, you had a question for me?
I did. I had a question for Dr. Shaw. My question for you, in regards to the death toll now at 62 in the state of Maine, I'm wondering how the state is determining that death toll. It's something we've gotten a few questions about, if those deaths are from definitively from COVID-19, complications with COVID-19, or if perhaps those are folks who tested positive for COVID-19 but may have died from other causes.
Sure. So Hannah's question is around the way that the U.S. CDC and all 50 states think about death tolls. And in this regard, Maine CDC follows the guidance of the U.S. CDC and tabulates death tolls the same way that each and every other state health department and city health department does, which is to say we all collectively report when somebody has passed away with COVID-19. The ultimate determination of when someone has died from a disease is something that the medical examiner makes. Not every case may have an autopsy, but if they do, then we try to make sure that we've synced that up. This necessarily in the moment is needed because we want to be able to report the facts and figures as they change. Right now, when you think about something like COVID-19, we want to be able to provide the best snapshot of what's going on. But because of how quickly things are moving, at best, it's like taking a Polaroid of a bullet train. It changes almost instantaneously the second you've got the numbers. So of course, things do change. There might be a couple of individuals for whom this is an undercount or an overcount, but also bear in mind that in any outbreak, we're only seeing a part of the iceberg. So there are other people out there who may have also passed away from COVID-19, but without getting diagnosed. But what I'd like to just underscore for everybody is that there are necessarily limitations in the way that we report these numbers, but the way we report them is uniform across all 50 states and across all the large city health departments in the country. We follow the pattern that all states have followed, not just for COVID-19, but for each and every infectious disease out there. We're going to turn next to Lauren McCauley over at the Maine Beacon.
Hi, thank you, Dr. Shaw and Governor Mills. I have two questions for Governor Mills.
Okay.
The first is, do you plan to issue a guarantee that employees whose industries have reopened can continue to receive unemployment if they decline to return to work for, public health reasons?
Do I plan to issue a guarantee? Well, I think we have federal and state laws on the books regarding unemployment right now. There are some exceptions from the looking for gainful employment requirement of unemployment, and some of those have kicked in during the COVID-19 crisis, but I can't tell you what those are. I'm not an expert in that area. The general rule is you have to accept employment if it's offered to you, but I think one of the bills that the legislature passed, an emergency bill, did allow for temporary layoffs and for some exemptions from that rule because of the pandemic. Second question?
Yeah, thank you very much for that. So yesterday, Dr. Shaw, we posed a similar question, said he couldn't speak to why hair salons and not other similar businesses were slated for reopening, such as massage parlors. Can you say how much those decisions are made and how much they're based on economic concerns versus public health considerations, and just how you weigh those competing concerns?
I think, and Commissioner Johnson is here also to weigh in because she's been heading up these multiple sub-working groups on different sectors and different kinds of businesses. I think partly what's in play here is that different sectors have come to us and helped devise protocols that they think would be appropriate. Like I said, I've never run a hair salon. As you can tell, I've never run a restaurant. I've never run a small mom and pop shop. Those people are coming to us with ideas about how they can open up again, how they can do business and keep their customers and staff safe. Commissioner Johnson, do you want to weigh in on that at all?
Yeah, thanks, Governor. As it relates to hair salons, there are a lot of things about hair salons that would put them to the front of the line. One is generally you go to the same hair salon on a regular basis, which allows for a minimization of travel throughout the state, right? You have a local salon that people use, and it's hard to get people to change their person, and so you minimize travel there. salons also are very comfortable with the people that are coming in, and so generally they have contact information for people, and so they have clear records, they take reservations. Salons also have very high hygiene standards to start with, so when you layer on additional protocols, it's fairly easy for them to manage. Additionally to that, we have over 2,600 salons in Maine. Lots of them are owner operated, which allows for a lot more control in the decision process of the owner actually being the person that is in the position to do the work as well. And so, it gives people the control of their own decisions. So I think there are lots of reasons that went into salons being in the first run. Most of them are about public health, but certainly there are economic components there as well.
Thank you.
Thank you so much.
Great, thank you. We'll turn now to Amy Brown over at WERU.
Thank you, Dr. Shaw. I have two questions for Governor Mills from our listeners. One, the first one, some listeners from the Old Town area say that about 30 truckloads of waste comes into Maine each day from Massachusetts, some of it ending up in Old Town. And they would like to know if any precautions are being taken with the way waste is handled, given that it and the smugglers are coming to have cases. The other listener wanted to know if the state is helping municipalities providing any PPE to town clerks as they're starting to reopen in some places.
Town clerks and PPEs. And the first question was about the truckloads of waste coming in from out of state. Good question. And I'm not sure the answer. Truckloads of waste coming into Old Town and other areas of the state. Are there precautions being taken? I'm not sure. Maybe it's a question for Bruce Van Note.
What I can say just in general terms, Amy, is that the U.S. CDC nor Maine CDC, neither of us recommends any particular types of precautions or recommendations around the handling, transport, or disposal of waste, provided those individuals are coming in, visiting a landfill to make those drop-offs. There's nothing per se that needs to be done to the waste separate and apart from the normal precautions that would otherwise be taken in the handling of such materials.
Sorry, and the second question was about whether we're providing PPE to town clerks.
Yes, town officials, as some of them are starting to reopen town offices. Is the state helping out with that?
I don't know that we've gotten those requests. Have we gotten requests from towns?
I haven't seen,
sure.
We can check to see if we've received requests, but what I will say is that given that PPE remains a scarce resource, we're making sure that we first provide PPE to individuals who are working in congregate settings like nursing homes, as well as first responders at the local level, like local fire, rescue, and EMS. Those are the folks that we know are coming into daily contact with individuals who are positive for COVID-19. That's where we're focusing our efforts. But as we think about reopening, we're also evaluating for whom else we might want to provide PPE for.
Well, I think we would also recommend the use of plexiglass, if there is none right now, in certain town clerks' offices. And I know in my area of the state, town clerks are maybe only open one night a week, one day a week, and it's difficult for them to interact, sometimes out of their own kitchen with the public. So every town's going to have to make an adjustment, and I'm sure they're all looking at that.
It underscores the need as well for why everyone who's visiting an office of that nature, whether it's the town clerk or the bank or any type of situation when you're coming into contact with the frontline worker, the grocery store, that face covering is yet another added layer of protection to prevent you from potentially infecting somebody else. We're going to turn now over to Caitlin Andrews at the BDN.
Thank you very much. I have two questions for the governor. My first question is, Hospitality Maine has teased that the administration may be looking at loosening the restrictions on restaurants and lodging, including by shortening phases of your plan or getting rid of the 14-day quarantine requirement. Should we be expecting that? And is public pressure on those issues prompting you to reconsider your plan?
You know, when I said a week ago when we unveiled the plan over a week ago that it was a flexible document, intended to be a flexible plan. We're hearing from a lot of different people, and we're hearing different ideas about how they might be able to reopen at an earlier stage or in a particular geographical area, taking that all into consideration. it's a public health issue and an economics issue. We're trying to meld those two priorities every day, every hour. I can't guarantee you that we have an announcement on something of that sort right now, but hopefully we'll be able to come up with something in the next few days.
Thank you. And my second question is, I wanted to ask you what you think of the Orrington Church that has brought a complaint against your administration federal court challenging the in-person prohibition on worship. And I wanted to ask you what you thought about their main argument that their constitutional rights have been encroached upon by that.
I haven't read the lawsuit. I heard about it. I'm not sure if we've even been served with it. But we've been in touch with churches of all denominations constantly and trying to devise ways in which they can each practice their faith, because I think faith and worship are extremely important during these trying times. I myself attend church by Zoom. It's interesting. It's different, but there are a lot of people doing that. And I think we heard from the Maine Council of Churches recently, who represent 55,000 different Christian parishioners in this state. And they said to us, we are fervently asking Maine's churches to continue to willingly refrain from in-person worship gatherings as an embodiment of the love you have for neighbor and self, as a faithful response, quoting here, to the biblical mandate to protect the most vulnerable, the marginalized, the weak, and defenseless. So while I respect everyone's First Amendment right to practice their faith and their religion, the religion of their choice, I suggest that public health demands certain changes in the way we do a lot of things, and most of the churches in Maine understand that, recognize that.
Thanks, Caitlin. We will turn now over to Michael Fern at the Maine Edge.
Thank you, Dr. Shaw. Both my questions are for Governor Mills. And I'm sorry, Governor, the first question is a little long because this is actually based on what's happening over at the Maine legislature right now. Just minutes ago, during the labor hearing, Commissioner Fortman and your administration came under fire from both Democratic and Republican senators during questioning when it was revealed by Senator Stacey Guerin that Maine actually had an opportunity to seek a private public partnership to solve the unemployment crisis here in Maine. Maine's Google account manager said yesterday.
I'm sorry, Maine's what? Maine's what?
Maine's Google account manager.
Google account manager, okay.
Yep. Sorry, I'm having some issues here.
Is there a question?
Yeah. Basically, the question was from both senators and Chairwoman Chinabellos is, could we have solved this problem through some kind of public-private partnership for actually a pretty good price? I'll take that question first.
That's a question to me?
Yep.
Look, we've engaged the private sector. In fact, we hired about 100 private contractors to help respond to the more than 100,000 unemployment claims under the 4 or 5 different new unemployment paradigms that we're facing. And as of last count, we've put $200 million out the door in unemployment funds, and we're working on the newest, the federal pandemic unemployment assistance program, and getting that out the door the fastest we can. I completely appreciate if somebody's been, waiting tables for 5 years for different restaurants, or somebody's run a hair salon for 20 years and self-employed, or somebody's done roofing jobs and snow plowing, and suddenly they find themselves unemployed and under a whole new program, don't have the documents, don't have what's needed under the federal rules to apply and to be awarded unemployment as quickly as possible. These are challenging times for all of us, and I appreciate what all those businesses and people are going through.
Right, but I think I fixed my mic. What the nonpartisan statements are saying, though, legislators, is the fact that the administration's approach to try and solve the problem has kind of been uninnovative. How do you respond to that? I mean, this is coming from both parties.
I'm sorry, I'm not listening to the committee hearing, so I'm not hearing what you're hearing, and I can't respond to questions in a committee meeting that I'm not part of. Really, that's not a fair question, to be honest.
All right, and my second question has to do with state finances that you mentioned earlier.
Yeah.
I believe the report from the Maine Controller is due to be released today or tomorrow. Do you know what those revenue figures are now and how much the budget deficit will be?
You mean the figures for April, the monthly figures
For April, right?
You're asking me what they're going to be?
Yeah, have you seen those figures yet?
No, that comes from the controller, and as you noted, they're not out yet.
Okay. Thank you.
Thank you.
Thanks, Michael. We're going to turn now to Ashley Blackford over at WAGM.
Thank you. This question is for Governor Mills. A lot of migrant workers come into our state to work, especially up here in Aroostook County. Are there any rules surrounding them, or are you requiring them to quarantine for 14 days? Are you working with the farmers on this?
Yes, the H-2A program, I think, is what you're referring to, and I understand there are people coming into Aroostook County to help with the broccoli planting and that kind of thing, and they are required to quarantine.
Great. Thanks, Ashley. We'll turn now to TJ Trumbull over at ABC 7.
Good afternoon. Governor, do you know how local authorities are determining whether someone has violated the 14-day quarantine? And also, do you know whether there have been any enforcement actions regarding the 14-day quarantine?
I'm not sure on the latter. You know, oftentimes they're reported, apparent violations of the order in various respects would be reported to local law enforcement first and foremost, or perhaps to a licensing agency, or to the local district attorney. I don't have a list of cases or statistics on that.
Do you know whether that's sort of like a neighbor snitching on a neighbor type of situation?
I can't speculate. I can't speculate. Sometimes violations might be very public, sometimes not. So.
Thank you.
Thanks, TJ. We're going to turn now to Dustin Vlitkowski over at New England Cable News.
All right, I have two questions for the governor, and I'll just start with the first one first to separate topics. The first is, are there examples of more specific innovative solutions to open some businesses like restaurants, like using parking lots or closed streets as dining space, that type of thing? I know that Commissioner Johnson was supposed to go to Cliff House to talk to folks there. What specifically has come out of those discussions? You talked about Church Street. Is there a blueprint to actually do something like that in Maine?
Thank you. That's exactly what we're working on right now. There is actually some kind of restaurant subgroup, and Commissioner Johnson can share some of their ideas, maybe.
Yeah, we certainly appreciate the Cliff House inviting us down. Commissioner Lambrou went with me as well because, again, as you look at this partnership and kind of trying to find this balance between opening things up but opening them up safely and in an appropriate way, we have a very close collaboration on that work. And so Commissioner Lambrou and I both went to the Cliff House earlier this week. We stopped at a couple of other restaurants as well to look at kind of what does plexiglass look like in front of counter service. Things like how would you space tables and how do you block tables and how do you give restaurants flexibility but still keep 6-foot distance between tables? How can you create one way in and one way out of restaurants so that you don't have face-to-face traffic? Things like that. And they had a variety of creative ideas. Again, to the governor's point, businesses know their business best. And they are coming up with the most innovative solutions, and so we are following their lead as part of that.
I mean, look, two of my favorite restaurants are Helen's in Machias and Becky's Diner in Portland. Very different paradigms, very different physical setups, and they're all being innovative and coming up with some ideas how they can reopen safely.
Second question. Governor, how are you measuring public opinion on the crisis and what should be reopened when? Is there polling you're doing internally? Are you looking at other studies done elsewhere, or is there another gauge that you're using?
There is no gauge. I am not putting my finger to the wind and figuring out which way the public pulse is going, which way the wind is blowing. That's not what this is about. It's not about politics. It's not about popularity. It is about protecting the lives of Maine people. That is our highest priority, protecting the lives and health of Maine people.
Thanks, Dustin. We're going to turn now to Joe Lawler over at the Press Herald.
Yes, hi. Thanks for taking my question. The first question is to Governor Mills. Considering that, and this is kind of piggybacking on the idea to reopen outdoor seating for restaurants. But I'm wondering about other outdoor activities, especially after June 1st. Do you think there'll be like maybe allowing tennis courts to reopen, youth sports, other gatherings that are not 50 people, but are more than fishing and hiking?
Fishing and hiking are okay with social distancing.
Yes.
No, you raise an interesting point. I would love nothing more than to allow little league games to start up again and tennis matches, but these are things we're looking at case by case, sport by sport, sector by sector. They all have different issues when it comes to personal contact. Obviously, basketball, for instance, usually, if it's played right, involves a lot of personal contact. Baseball, maybe not so much, except if you're sliding to third base, etc. But in the tennis, people are handling the same tennis ball. We've got to look at each of these things in some detail, again, with respect to the physical contact, social distancing, and the public health needs.
And my second question is for Dr. Shaw. What is the current status of the contact tracing workforce, and do you have enough workers currently to trace all the current outbreaks?
Sure. So Joe asks about where we're going with contact tracing, and Joe, what will determine the ultimate size, the ending size of our contact tracing workforce is what the numbers look like with respect to the outbreak. So right now there are at any one time anywhere from 30 to up to 50 people right now that are engaged in contact tracing in different forms. Some of them are lead epidemiologists that are overseeing several others that are working on complex, multifaceted outbreaks like those at long-term care facilities or, say, at a meat processing plant. Other contact tracers are making the one-off phone calls to individual members who have been diagnosed. Our plans that we've drawn up are really based along three ideas, or three planks. The first plank is to hire more of the really complicated gumshoe epidemiologist disease investigators. And there we foresee needing anywhere from 20 to up to 50 more of those individuals, again, depending on what the complexion of the outbreak looks like. The second plank are the more standard contact tracers. These are the folks that are calling folks on the phone after they've been diagnosed, telling them that they need to stay inside for 14 days, getting a list of their contacts, calling all of those folks, giving them the advice on quarantine. And then the third piece is an IT piece. We will soon be able to announce a system that we're going to be rolling out that will help us keep really good tabs on how the data are evolving and what that tells us about the changing nature of the outbreak. Overall, at the highest numbers, Joe, it's possible that we may have a total force of up to 100 people conducting contact tracing, but that really does depend on where the cases go and how successful we are at keeping those numbers down. We evaluate that about 3 times a week. Our team meets to take a look at the numbers and scale our hiring accordingly. Next question goes to Emily Tadlock over at WABI.
Thanks so much, Dr. Shaw. I actually have 2 questions for the governor. The first one, Governor Mills, is about retail businesses. We've heard a lot from different retail businesses frustrated that certain places are able to open, but they are not, even though they could conduct their business in the same way that, say, Lowe's or Home Depot or Hobby Lobby could. What do you have to say to that?
We're looking at retail all across the state. We're looking at large and small. And we have already set customer limits for different sizes of stores already, even those that were deemed essential in the beginning, grocery stores and other stores that sell essential products. And we're looking at evolving that. We're looking at expanding those parameters for smaller retailers across the state. Can't give you specifics yet. I wish I could, but it's something we're concerned about. Just yesterday, I talked with Curtis Picard of the Retail Maine Association, and we've discussed a lot of ideas of how people can do business safely sooner.
Okay, thank you. And my second question is, Senate President Troy Jackson of your own party has sent a letter asking for an advisory council to be set up. you've mentioned in the past that you wanted to do this. I know you said today you set up the Economic Recovery Committee, but I think many people are wondering if you're going to have any sort of committee to help you figure out more about this reopening plan and how it could be better implemented. Do you have any plans to make that advisory council? And, you know, what do you have to say to all lawmakers on both sides who have said that you haven't involved them enough in your decision making and, quote, acted alone?
Oh, okay, well, let me start out by saying we have had hundreds of emails and communications from lawmakers, legislators, practically every day through their staff or directly from them, and we've tried to answer the questions as best we can. And many of them share the ideas from their constituents. They are, to some extent, our ambassadors to the broader communities, and they appreciate their jobs as representatives of those constituents. And I appreciate that job myself, having been in their shoes for 6 years as a Maine legislator. At the same time, we're in the middle of a pandemic. Maybe I sound like a broken record, but this is a pandemic. It is a public health crisis, the likes of which we haven't seen in more than 100 years. We're making decisions based on thousands of consultations, advice from all around the state, not just legislators, but people in all sectors of the economy, all walks of life, all businesses large and small, working people in every county of the state. We're taking all of that into consideration in the decisions we make every day. It is advice that sometimes comes in the middle of the night. Sometimes it comes by email. Sometimes it comes through the portal, the two portals that we've developed through the DECD, one for legislators and one for non-legislators. Thousands of pieces of information, observations, and ideas. We're taking all of that into consideration. And we're making decisions as best we can. I thought Commissioner Johnson explaining the situation with a hair salon gave a perfect example, hair salons, of how we're making the decisions based on input from the various sectors and the businesses that know how to do what they're doing.
Great, thanks, Emily. And today's last question goes to Megan from WMTW. Go ahead, Megan.
Thank you both. These questions are for two questions for Governor Mills. Governor Mills, Senate President Troy Jackson has called on the creation of a council for immediate term reopening issues, anything arising immediately. And the council you talked about today is more focused, it seems, on longer term recovery with, the final report being due in December. A, what is your response to this request? And B, is there something that you will be doing more immediately to respond to that?
Megan, I think I just addressed that same question from the previous questioner. And basically, we're taking input from all sources everywhere across the state. This is an emergency. It's a state of civil emergency. We remain in a state of civil emergency. In an ideal world, in a quote-unquote normal world, I would be happy to set up committees to do a lot of different things. But this is an emergency state, and we're making decisions as best we can with as much input as we can from all sources based on the public health needs of the hour and the day and the moment.
Also, just finally, your message to businesses like restaurants that defy the executive order, would you like to see owners prosecuted and jailed? I mean, what would be the ultimate message to them?
Would I like to see anybody prosecuted? I would hope not. I think thousands of Maine businesses, restaurateurs, corner stores, every kind of business in the state of Maine, thousands of them have understood completely the situation we're in and the great danger that is posed when you invite the public into your business, when you potentially expose customers and staff to a deadly epidemic, a deadly virus that can carry through the community in a heartbeat. Pretty near everybody in the state of Maine understands that, and we can't underscore that more cogently. People are staying home. People are protecting their families, their grandparents, their cousins, their children. People know what we're in because they've seen the news from other states where things have opened up too soon, seen the crowds on beaches, and seen the numbers skyrocket. They see 10,000 people in Boston right now sick with that virus. And we're trying to protect people here in Maine, here and now. And everybody in the state of Maine knows that and knows why we're doing what we have to do right now. And I thank them for their compliance and their compassion and their courage.
Governor, that was the last question.
Well, that's about all I have. I just want to end by thanking Dr. Shah and thanking him for recognizing Florence Nightingale and the nursing profession and the thousands of people in Maine who are working right now as nurses in and out of hospitals, nursing homes, clinics, FQACs, HCs, and to pray also for the people they're caring for, including the 18 people right now in intensive care in the state of Maine suffering from this virus, the COVID-19 virus. We pray for them to survive and for all Maine people to stay safe and healthy till the next time we talk. Thank you.